folks. Today I'll be discussing the core set of tools used in the diagnosis of epilepsy. These include EEG and MRI. EEG is short for a study called electroencephalogram. It's a study that can be done at home or in the hospital, and it can take as few as a few minutes or last a few days. An EEG begins with the placement of electrodes on the surface of the scalp using a sticky substance that dries into a kind of paste to secure the electrodes in place for the duration of the study. Once the study begins, the electrodes at the surface of the scalp record the electrical activity from the brain in real time. The data is then transferred to a computer where your neurologist can access the data and interpret its findings. An EEG is best read by a neurologist with specialty training in the interpretation of studies of electrical abnormalities from the brain and nerves. These neurologists are said to have completed fellowship in neurophysiology. Sometimes these neurologists will have completed an additional specialty training year in the management of complex epilepsy. We'll discuss the importance of finding a neurologist with expertise in epilepsy in an upcoming knowledge nugget. An EEG can identify many interesting things about your brain, including its normal background electrical activity, patterns associated with opening and closing your eyes, specific features associated with sleep and movement of your limbs, as well as other normal electrical activity of the brain. An EEG can also identify evidence of abnormal electrical activity of the brain, including the potential for having a seizure or even small subtle seizures which can go unrecognized. An EEG is just a single snapshot in time of the electrical activity of your brain during the time that the electrodes were on your head. So a short study might not be particularly revealing. However, it may suggest that there's a need to do a longer study where more data can be captured. Sometimes an EEG is performed with patients on a video camera. The purpose of this is to try to capture spells or other strange events which may be concerning for possible seizure activity in comparison against the brain's electrical activity at the same time. That wraps up my brief introduction of EEG. Next, I'll move on to an introduction of MRI, or magnetic resonance imaging. MRI is a way of taking pictures of the brain using magnetic energy. An MRI will frequently be ordered early in the evaluation of someone who's experienced an unprovoked seizure to look for any evidence of a brain abnormality which may have contributed to that seizure occurring. There are many different brain abnormalities that can cause a seizure, and only a very small handful of them are concerning for anything like cancer. Other abnormalities which can be associated with seizures include developmental abnormalities or a vascular malformation, which can include a bundle of abnormal blood vessels in the brain. Frequently, these can cause seizures depending on where in the brain they're located. Not everyone with seizures requires a brain MRI to be completed, but it is a study worth asking about if your doctor hasn't mentioned it to you. A brain MRI is usually performed either at a hospital or at a medical imaging center. The study itself does not require hospitalization, but the equipment is very large and frequently located at large hospitals. The study usually takes about 45 minutes to be performed, and it can take up to a few days for the radiologist to interpret its findings. The radiologist will then send a report to your neurologist, who can discuss its findings with you. As with an EEG, it's important to have your MRI interpreted by a neuroradiologist or a radiologist with specialty training in brain radiology to ensure that subtle or very small findings don't get missed. You can ask your neurologist when they discuss the findings of your brain MRI with you if the radiologist who interpreted your study was a neuroradiologist. This is information they should be able to locate. If not, you can ask for a second opinion that your brain MRI be interpreted by a neuroradiologist. Many patients who experience seizures will have a normal MRI, but it's an important box to check, so to speak, just to be sure that there's nothing in the tissue of your brain which may be causing your seizures. While you just have to lie quietly and stilly for the duration of the MRI study itself, some patients do describe the study as uncomfortable or associated with claustrophobia because of the small space that the MRI is completed within. The noise can be very loud. You will be provided with earplugs to protect your hearing. However, it can be a bit unnerving. So there it is, a brief introduction to EEG and MRI, important studies in the early evaluation of epilepsy. Please feel free to leave a like or a comment and subscribe to be notified when more content is posted. More information is also available on my website, epilepsyacademy.com.